Here is ethylene glycol. Ethylene glycol is a liquid that is colorless, clear, and at room temperature syrupy. And it's found in a lot of stuff we use every day. And it can even be used as a pharmaceutical vehicle in manufacturing of drugs. Some other characteristics is that it has a sweet taste and can easily be ingested either on purpose or by accident. It's also odorless. And the main danger with ethylene glycol is that it breaks down into toxic compounds in the body, and then it also affects the central nervous system, heart, lungs, and can even result in death. Ethylene glycol can be came into contact with either by indoor or outdoor air, and both of those release into the air with liquid spray, vapor, or mist. Water, food, and agricultural are also possible exposures. Some of the obvious exposure routes are going to be through ingestion, and actually, those breathing vapors can also irritate your eyes and obviously the lungs. Those are unlikely to enter the body and cause toxicity. Ethylene glycol really doesn't absorb through the skin, and so it's very unlikely to cause any systemic toxicity and dangers. Signs and symptoms of ingestion can happen within 1 to 4 hours, which is pretty quick through the stomach, and 80% or more of that can convert into chemically toxic compounds. We see that in stages with ethylene glycol. Your first one being the neurological, then cardiopulmonary and renal, which is what can be very fatal. And ingestion of alcohol along with ethylene glycol can actually delay the negative health effects of ingestion. The short term effects of ethylene glycol are actually very similar to E2H intoxication, except there's no odor on the patient's breath, which is a big key for that. And then there are other effects that are very similar to E2H ingestion that are the initial effects of ethylene glycol. The byproducts that come about once ethylene glycol metabolism has started is what can cause a buildup of acidosis in the body and can ultimately be fatal if they're untreated. There is hospital therapy that includes antidotes and more long term patient management for exposure and toxicity with ethylene glycol. But in the pre hospital setting, the best thing you can do for the patient is to manage the ABCs and support their comfort with treating symptoms.